Hey everyone. I'm going to try just really, really hard to get to the point for this episode. Cut past all the nattering and yammering and BS that quite often just bumbles out of my mouth at the beginning of these episodes. For, I think, this episode, even more than the other ones, and I feel that all the episodes I've done have been great and very important. I think this one might be the most important, and very much more so than the other ones focused on one topic, whereas the other ones really touch into all sorts of different issues to varying degrees. But this one is just one topic. So I don't want to keep rambling on and on and on and on with my crap. So I might then send people running to the hills, because I think this is an important public service message in its own right. So this episode is on the fact that the virus is airborne and aerosol transmission, which hasn't got enough public conversation and attention. And as is shown in this episode, is pushed down overtly. So my guest is Professor Jose Luis Jimenez. He is a professor of chemistry at University of Colorado Boulder. So here's our conversation on COVID being airborne. Cheers, guys. All right. Well, first, thanks for doing this. I really do appreciate it. And, taking up your Saturday. But to start off, can you just go over the basics of what is going on with aerosol transmission and what that specifically entails, and why anybody listening to this should, take this very seriously?
Okay. Well, thanks for having me. Aerosol transmission we believe, is the main way this virus is transmitted. So that's why anyone should care, because if you want to try to avoid getting infected or try to get your family or your coworkers or your friends to avoid infection, you need to understand how we get infected. And basically, it's simple. When we talk, when we breathe, when we shout, when we yell, when we cough, we expel an invisible smoke, which is what an aerosol is. And it's basically little balls of saliva and respiratory fluid that may contain the virus if you're infected, and that float in the air like cigarette smoke. They don't go very far, they don't fall to the ground like these larger droplets that WHO and CDC talk about, but they just float in the air. And then we get infected when we inhale those that invisible smoke that someone infected has exhaled, especially in two situations. One is when we talk to someone very close, because then you are inhaling a lot of the air that they are exhaling. For example, that situation, if you talk to someone who has eaten garlic and you smell the garlic on their breath, is because you are inhaling the air that they are exhaling without much dilution. So that's a very dangerous situation. And that is why there is a lot of transmission in close proximity when you talk to someone very close. And the other situation is when you share the air of a room. Kind of like if you talk to a smoker, you would always have breathe more smoke. But if there is a smoker in the room and both of you are there for an hour or for 2 hours, the smoke is going to fill the room over time and you're going to breathe it in, and then you may get infected. And that's what happens in a lot of the super spreading events like the choir case that we studied, or the restaurant in China, or many others that have been in the news.
Okay. So what you mentioned the CDC, WHO. What were these organizations saying early on about airborne transmission?
Well, very early on, it wasn't clear, and there were mixed messages coming out. And so Dr. Tedros, the head of WHO, I believe it's on February 6th, he said that coronavirus is airborne. And as we know, former President Trump also told Bob Woodward in an interview that you get it in by breathing it in. So there were, certainly there was the impression that it was airborne early on. But then that changed. And on February 28th, WHO came out with a big announcement that is very clear in big bold letters. It is a fact that this virus is not airborne. And they said even more, to say that it is airborne is misinformation. And they were asking for the public's help to help fight this misinformation. And they said the virus is transmitted in two ways. It's through surfaces. We touch a surface and then we touch the interior of our eyes, our nose, or our mouth, and we get infected that way. Or through these large, what they call the droplets, which are basically also balls of saliva and respiratory fluid that come out of us as well, like the aerosols. But the difference is they are much bigger. And because they are much bigger, they fly through the air like a projectile. And then they may hit you in the eye, they may hit you in the small exposed area of the nostrils, or they may hit you inside the mouth, and then they can get you infected. But if they don't hit you, then they fly like a cannonball and they fall to the ground, right? So those two were the things that they have told us they were the most important. And to this day, both CDC and WHO still say that these droplets is what's important. And the problem is that's completely wrong. And this has done a lot of damage. You know, we have spent billions and billions of dollars disinfecting surfaces, and now we know there is 0 cases that have been confirmed of transmission through surfaces. And all that effort has been misplaced. And we have also, you know, since we were defending against these projectiles that are easier to defend, so you just need to keep your distance, we haven't really understood how masks should be worn, or some of the control measures have not been applied. And this has really done a lot of damage in controlling the pandemic. I mean, if you think about this virus, it's not so transmissible. You know, each person on average gives it to 2.5 people. I mean, with the original version, now we have variants that are more transmissible. So we would only need to cut transmission to 40% of what would happen without any control measures. And then this R number is below 1, so each person gives it to less than 1 person, and we can control the pandemic. But we have not been able to keep the transmission at 40%, or as if we did nothing. And that has been because we have basically spent a lot of effort doing things that do nothing or do very little. And the things that really work, that are not that difficult, we haven't done, or we have done very poorly.
So you mentioned that they were trying to get the idea across that anything contrary to what they were putting out was misinformation on the matter of it being airborne. At what point, and you said presently that they're still trying to focus on large droplets. So at what point did, or have they changed their messaging where it wasn't misinformation, but just a matter of lesser significance?
So this has been evolving gradually. So it was March 28th, as I said, where they said to say that the virus goes through the air is misinformation. Then on July 6th, I wrote and signed with 238 other scientists a letter that we sent to WHO, where we were arguing that airborne transmission was important. And a few days later, in July 9th, they published a report where they no longer said it was misinformation, but they make it sound, so they use words like, well, there are theories and hypotheses that maybe aerosols could matter and it could be possible, but we don't know and there is no evidence. And so they go from saying this is just impossible to saying, well, it's possible, but it's just unlikely. And, you know, and therefore it's not something we should spend much effort fighting because it's something that's unlikely, right? And at the time we had already studied, for example, the Choir case, but they dismissed the case saying, oh, this could be the droplets or the surfaces, which is completely wrong. And they knew it and we had told them, but there was this very entrenched resistance. Now, later in the year, I mean, as more and more evidence accumulates that really is not being transmitted through surfaces and is really going through the air, in November, Maria van Kerkhove, Maria Neira, that are two people very high up at WHO, they both said in press conferences and a video that ventilation was very important. You know, so they said, oh, ventilation is very important and you should ventilate, you know, have 6 air changes per hour and all of this. But they didn't say a word of why it was important, you know. So, but if you think about it, if the virus is in a surface, it doesn't care that you open a window or not. It's going to stay there. And if the virus is in a projectile, it doesn't care if the window is open or closed. It's flying in a projectile, in like a microsphere. So the only reason ventilation is very important is if the virus is in the air floating like smoke. And if you open the window, the smoke goes outside. So already in November, kind of they knew, but they refused to say it clearly. And to this day, we are kind of still in the same situation. They haven't said clearly that it goes through the air and that the air is the main way of transmission. And I'm talking about the WHO. The CDC is a slightly different story, but at the end, they end up in the same situation. They have been saying that ventilation is important and things like that, but they don't explain why. And they keep talking about these droplets, and that's just incorrect.
So, do you have any idea why? Because from somebody just looking in on this situation, it's bizarre, and it, actually very bizarre. So why might they be engaging in this sort of messaging and on multiple fronts? Like, why are they having this strange aversion to really presenting the airborne factor out front and center, which is also going to aid people with mask use and ventilation, et cetera, but also, like, why is there this adamancy to keep pushing really, really hard the like, it's important to clean surfaces and wash your hands, but it's almost like this acute obsession that's being put forth of that's the most paramount thing you can do. So why are they engaging in this sort of messaging?
Well, so that's a great question. And it has two answers. One is historical and the other one is practical. So let me explain a little bit. And I have to say, I didn't work in this field. I work on aerosols and I know a lot about that and basically everything else, but not the disease transmission. And I got involved around February, March, when it was clear the pandemic was not going to be controlled, and started to work with some of the world experts on this field. And I was equally perplexed. What you just said is what I was saying there. It's like, why are they so resistant? It seems relatively clear that it's going through the air. What I have learned in the months in between, and we actually have written a paper on this history that we are about to submit, is that there is basically a denial of airborne transmission possibly being important that goes back to 1910. So, I mean, through the history of humanity, humans have thought diseases go through the air. And this started with the Greeks. Actually, Hippocrates was the one who said, diseases go through the air. And there was the miasma theory. And this was something that was very frightening and very disabling, because if it can come through the air, what could you do? You cannot defend yourself against it. And then in the 1850s and 60s, Pasteur in France and Koch in Germany kind of demonstrate germ theory, that basically to get sick, a germ has to enter your body and then it can replicate, and that's how infectious diseases work. But there is still the question that is that germ coming through the air, through water, through food? And in 1910, Charles Chapin, who's an American public health researcher, and he had created a new hospital in Rhode Island, he writes a book where he basically reviews all the studies that had been carried out about how diseases were transmitted, how infectious diseases were transmitted. And he conceptualizes what's called contact infection. The idea that people get infected when they're close to each other in this close proximity situation, right? And the germs go from one person to the other, and they're not going through the air, especially not people had the impression that, for example, the flu could leave Boston and then cross the Atlantic and infect someone in England. There was kind of like this idea that they will go through the air in this phantasmagorical way, right? And he says, no, it's being close to someone when there is contact, and that's how you get infected. And in the book, he says that the problem he's having in his new hospital is that because people still believe that they get infected through the air, they don't pay attention and they don't protect themselves from this contact infection. So then he says in the book, we don't really know if diseases go through the air because, I mean, they didn't have the technology to measure aerosols in 1910 and they just couldn't do the measurements. So then, but he turns this absence of evidence into evidence of absence. And he starts saying it's very unlikely that diseases go through the air, and therefore we can discard it as a hypothesis. And if someone wants to demonstrate that a disease goes through the air, then they really need to meet an incredible burden of proof because it's very unlikely. And this paradigm of contact infection being basically the main way we get infected becomes dominant. He was successful. I mean, social distance works. There was a lot of good things he promoted, but he becomes too successful for his own good. And this becomes a dogma. We call it the dogma of the droplets. And it has become dominant in public health and infectious disease control till this pandemic. Basically, during the 20th century, there are researchers that start to work trying to demonstrate that no, there are diseases that go through the air, in particular tuberculosis. So William Wells at Harvard, starting in the 1930s, starts working on this, but he's ridiculed. He's told that he's trying to bring back miasmas. And for example, Alexander Langmuir, who was the first head of the CDC, basically ridicules Wells, and he says in the 1950s that basically Wells had failed in demonstrating that any disease whatsoever could go through the air. So there was this entrenched belief for decades that no disease could possibly go through the air. They do continue studying it because they do believe humans can make bacteriological weapons that do go through the air, So, but natural diseases do not go through the air. And then, we start to develop vaccines and antibiotics and whatever, and just these questions of transmission have never been prominent really, again, until now, until we had a disease that we had no immunity and that was transmitting like crazy, right? And suddenly the scientific community has really poured to study this problem. But on April 3rd, for example, we talked to WHO. So a few days after that March 28th announcement, Lydia Moravska, who's a scientist in Australia, she gathers a group of scientists, including me, from different fields, different countries, and then she contacts WHO. And very quickly, we talked to them on April 3rd. But we encountered that they are all Chapinistas. They all follow this doctrine of Chopin, that basically airborne transmission is kind of crazy that we're suggesting it. And it's something very, very unlikely. And what's our evidence? They keep asking, what's your evidence? And then we say, well, we have these pieces of evidence. And then they say, that's nowhere near enough. And we responded to WHO. But you have even less evidence for transmission through the surfaces and transmission through the large droplets. But however, even though you have even less evidence, you are telling everybody that this virus goes through the surfaces and goes through the large droplets. And they say, well, but that's something we know, so there's kind of, they come back to this history and this error, and basically they didn't listen to us. And we continued talking to them and we exchanged letters, but it was clear that we were not going to get anywhere. And we told them, you should, in the case that you don't know, it may go through the air and that has important implications. We should adopt what's called the precautionary principle. We should assume that goes through the air and take those precautions. And then, that better safe than sorry, another way to say it, right? But they refuse to do that, and to this day, they refuse to say it clearly. And in many, many countries where I will give interviews or whatever, they are still disinfecting everything, and they are not doing anything about ventilation or about doing things outdoors or things that at the end are not that difficult to do, but because there is no emphasis and people don't think the virus is in the air, they don't do much. Anyway, so that's the historical reason. They are really entrenched in this dogma. And because for a century they have believed that aerosols were not important, they have not studied them, right? And the best example is there is a committee at WHO that is the committee that decides how the disease is transmitted. In that committee, there is 0 aerosol experts, but there is 6 hand washing experts. Why is that? And that continues to this day. Well, because they, as I said, they think it's very, very difficult that a disease goes through the air. So you don't need those experts because that's so unlikely. However, it's very likely that diseases go through surfaces. So you need a lot of hand washing experts. And the first thing they told us is that we need to do all this hand washing, which is a good idea. But it's not the only thing, right? So anyway, so there is that problem. And as I was saying, it's not that just the specific people that are WHO, it's the whole scientific field of public health and infectious diseases. I mean, it has been changing through this year, but still the people who hold power at WHO, at CDC, and at the ministries of health on almost every country are all from the same school that believe that transmission through the air is very, very unlikely, And they tell us things like, for example, they will say, we know COVID-19 is not airborne, it's not going through the air because it's much less contagious than measles, right? So then there is, and that's one of the things that they argue and they feel is a very convincing argument, and it's bogus in several ways. One is measles, as late as 1985, they were still telling us it was a droplet surface disease, just like they're telling us with COVID-19. Even though it's much more contagious, from 1910 to 1985, they still called it a droplet surface disease because it was transmitted better when in close proximity and all that. So they thought it was contact infection. And, so they kind of say now, if it was like measles, we would recognize it. But these same professions took 75 years to recognize it. So it's not like, these things are not obvious. And the other thing is this, the measles is more contagious than COVID-19, but tuberculosis is less contagious than COVID-19, and it's airborne. The only way you can get tuberculosis is by breathing it in. So the fact that measles is more contagious than COVID doesn't mean anything in this regard. Anyway, so that was a long explanation of kind of the historical reason. Then there is the kind of the practical reason that when we talked to WHO, they also told us, what happens, if it's airborne, then you need N95s, and there are not enough N95s to go around, and especially for the poorer countries, and this fear of scarcity. And in the US, things like the American Hospital Association, who are, I think right now they are just lying, but just because of cost, because it will be costly for them to admit that it's airborne, and then they have to provide other masks that are more costly than the other ones. Mm-hmm. The problem there is that if you don't say it's airborne, then you don't make more N95s. Just like we didn't have vaccines, but we got our act together and we invested a lot of effort and we've made very good vaccines. The same can be done for masks. And there is a lot of new designs of masks that are much better than the N95s. But there hasn't been, they haven't invoked like the Defense Production Act or invested, the federal government hasn't invested money on better masks and on distributing them, giving them to people or anything like that, like they have with vaccines, So it's like a chicken and an egg. By not admitting it, you don't solve the problem either.
Right. Well, and you mentioned like the cost of masks. You'd think that the input cost of getting the masks is just going to pay off massively too.
Mm-hmm. Sorry.
Oh no, go ahead.
When you think about the masks, the N95 masks were developed around 1990, and basically it was a good invention. Basically, in a mask you need three things. A mask is a filter, so that the function of the mask is that the air that you inhale as you exhale it basically passes through this cloth, right? And when it goes through there, most of the aerosols that may be coming in or coming out get stuck to the cloth, and then you don't breathe them in, or other people don't breathe in the ones you exhale. That's the function of the mask, is to be a good filter. And then it needs two more things, basically. It needs to be breathable. If it's a very thick piece of cloth that you cannot breathe through, then that's not practical. And it needs to seal to your face tightly, so that there are no gaps. If there are gaps, it's much easier for the air to go through the gap than to go through the filter. And even a gap that's 1 or 2% of the area of the mask, half of the air that you breathe goes through the gap, because it's just much easier for the air to flow there, right? So you need three things: filtration, breathability, and fit to your face, right? Now, the N95 was chosen because it's a material that's a very good filter and it's breathable. And then we make it fit to the face, but it doesn't do it very well. And then there is this whole cottage industry in hospitals of people who make sure the N95s fit well to people, all the fit testing and all that. right? And there is all these arguments that we cannot give N95 to people because they are not fit tested. Now, some scientists would say that, but there has been, I mean, they already existed, but there is new developments of these other masks that are called elastomerics, in which you take a filter, which is like an N95, which is breathable and is a good filter. But then with a piece of plastic, you mount it on a bit of silicone, the thickness of my finger that goes all around your face. And then you press that bit of silicone against your face, and that's a much, much better seal. Mm. So you eliminate this problem of the gaps that is so problematic, right? And these masks, for example, the one I have, which is one called Envo mask, that I don't have any relationship with them, but I like it. So I think they sell them for like $70. Now you think, let's say we make 300 million of these, and how much is this? So this is a few $1 billion, and you could give one extraordinarily good mask to every American for a few $1 billion. How many billions of dollars? I mean, we're talking trillions of dollars of damage to the economy, and all these packages of, we keep having stimulus packages of hundreds of billions and a trillion, and yet this has not been done. People are still wearing a T-shirt, a bandana, and things that have efficiencies of 10% and 20%, and then people get infected despite wearing masks, and then there is this resistance to masks. Oh, they don't really work, and also we don't explain why they are needed. So anyway, this creates a lot of problems.
Yeah, and explain that part of with, if everybody was, because I think there's hasn't been a lot of work trying to combat the idea that's gone into people's minds that, even if you let's say everybody is wearing, a fairly poor mask, much less a good mask, like how effective it is if everybody's collectively wearing a mask and how that scales up, because this is an idea that I've seen spread since, for a year now, is that, you take whatever really low end mask, like one of those really cheap cloth masks or something, and they'll work whatever, maybe 30% or something. And then somebody will say, well, masks just work 30%. So what's the point? So even if you had a whole bunch of people wearing masks that have, 50% effectiveness, explain how that scales up.
Yeah, so I mean, there's the concept. Yeah, like if you say it works, the mask I'm wearing, let's say I'm infected, and the mask I'm wearing is 20% effective. So 20% of the viruses I stay on the mask, and 80% goes through the air. And then I'm sharing a room with someone who also has a poor mask that's also 20% effective, but still out of that 80%, 20% of that gets filtered by his mask. So he's only breathing in 60% of the virus that he or she would be breathing in if neither of us was wearing a mask. So it's kind of, it compounds from person to person, and there is a chance that person doesn't get infected. And then if that person doesn't get infected, he or she doesn't go around and infect more people in turn. So it's kind of a compound interest situation, mm-hmm. in which masks help slow the propagation of the pandemic, and we see that in the studies that they do work in that way. But that said, since we're going to the effort and the annoyance of having to wear this thing in our face, why not wear? It's not that difficult to, as I was saying, with a few $1 billion, every American could have a mask that's 90 or 95% effective, and then you would really, and we wouldn't have to wear them for very long because really the virus would really go away. So it's just shocking that the kinds of things that we've been wasting money on with disinfecting everything, and then things that are obvious have not been done.
Yeah, and you went into great detail about how so much of this is rooted from certain people who will just not give up their dogmatic position. But how much of it do you think is from more so politicians and governments that they don't want to admit that for the past year they've had so much bogus policy and bogus messaging that they just want to they don't want to admit how wrong they are, and now the idea is that they really have their fingers crossed that the vaccine's just going to get rid of it within the next few weeks.
In the U.S., I mean, other countries are vaccinating more slowly for the most part, but I mean, I think, I mean, well, the politicians are complicated and they have a lot of faults, but I think the fundamental fault is with this historical error of the public health and infectious diseases field. I think because at the end, they are the ones that control the CDC. And if they had told, if WHO and CDC had told the politicians, look, this is airborne as it is, and we have to do these things, then the politicians wouldn't have been able to resist. And I don't think, I mean, my impression is not, I don't know of any case, and I've talked to a lot of people, you know, that you had CDC, the head of CDC saying, oh, it's airborne, and the Trump administration or the Biden administration saying, no, you cannot say that. I don't have any indication that that what has been going on. I understand what has been going on is that CDC and WHO have said, no, this is not airborne. And the governments have kind of followed, you know, they always, politicians always, you know, get involved in all these recommendations as we hear, but that's not where the fundamental fault lies. And I think there is an attempt to save face, in particular at WHO, but I think it's, again, is those specific high ranking people there and not the traditional politicians.
Right. Interesting. Now you mentioned like how they've these people have jettisoned the precautionary principle, but like doesn't that even seem more foolish? Like with what's been happening the last year in, say, Taiwan and Japan and South Korea, with you know their rigorous mask use, and you know clearly how much that is playing an effect. Or maybe is there even like any hard data that's even come out of those countries the past year for how much that's worked? Because it just seems bizarre to ignore all that with what's going on there on top of it all.
Yeah, I mean, but the problem is that these problems are very complex, right? I mean, a whole field of science can be confused for 100 years because really how viruses are transmitted, you know, when pathogen goes from one person to another, and then the next person gets 6 days later, it's very difficult to determine exactly how that happened, right? And when you think about the experiences in Taiwan or New Zealand or South Korea, they were doing many things. They were having more masking, but they were also much more aggressive and much more effective in contact tracing. And also, if you have been exposed to someone, you were forcibly quarantined, and they will, like in South Korea, they put you in a hotel, but they also bring you food and they pay for the hotel, and so they have been doing so many things that are different that you cannot just say, well, it's the mask or is this or that thing. And there has been, I mean, the Prime Minister of New Zealand, Jacinda Ardern, was at some point in an interview saying that early in the pandemic, she was shocked that most countries that she was talking to were not considering the idea of trying to eliminate the virus, of go after the virus until they had 0 cases, right? That most countries had accepted that they were just going to live with the virus. And I think that's the fundamental error, you know, in the US and in Europe and in most other places. And the countries that have been determined to eliminate the virus, like Australia, like New Zealand, like South Korea, have been by the most part successful, you know, or Vietnam, countries that have much less resources than the US, but they have had the determination, you know, to use, and the leadership that they were going to eliminate the virus, you know. So, I mean, and when you think at that level, I mean, airborne transmission is only one piece of the puzzle, and limited transmission is only one piece of the puzzle, or you know, understanding how it's transmitted. Because if you are very aggressive about tracing the contacts and isolating all the contacts and quarantining all the sick people, whatever, then they cannot transmit through any mechanism, through the surfaces or the aerosols or anything, right?
Right. So now back to something you were touching on earlier, and people in this field. How many How big of a field is this currently with people studying airborne transmission? As it would seem to some, it's a whatever a not a worthwhile endeavor or taboo even. Is this a growing? Is this field growing at least?
I mean, it has exploded during the pandemic. I mean, I think half of the aerosol scientists I know have been doing some work on this field. But before the pandemic, it was very small. And, I knew it existed, and I knew a couple of people that had been working on it and were good. But what they say is they were battling a perception that this was something very unlikely. And one very prominent colleague told me that multiple times they will submit a proposal to study airborne transmission of this disease, of that disease. And then, you have this anonymous peer review, and that peer review will come back and they would say, oh, it's not worth wasting money on this proposal because we know that airborne transmission doesn't happen. So then basically there were very few people who were studying this. I mean, a few dozens in the world. And I've been working with many of them over this past year, but it was a very small field for that reason, and it had been given very little attention because there was just this huge skepticism that it was important. And there is diseases like the flu, and it had really already been demonstrated that is transmitted by airborne transmission, and several colds and rhinovirus and the other coronaviruses and SARS, the original SARS and MERS, they all go through the air, just like COVID. But this has been denied and basically had not been accepted. And even though there are publications that are quite convincing, this has just been denied. So then this virus arrived and it got us into this mess because basically the knowledge that existed had not been accepted at the highest levels.
You said so around a year and a half ago, there only would have been dozens.
Yeah, dozens of experts in the world, I would say. Yeah.
Oh wow! And so, what happened in January, February of last year? At what point did you decide to really put all your attention towards this?
Well, as I say, I work on aerosols, and then I'm originally from Spain, and I have some friends from northern Italy from the time I was living in Spain, and I start to see how this virus is really not under control, and how can it be spreading so quickly if it's not going through the air. This thing about the surfaces and the droplets didn't make a lot of sense to me, but I didn't really know. But then one day, I think it was in February, I talked to my friend in northern Italy, who tells me how they're basically in the hospital just having to let people die. Like if you're above 60, then they don't even try to keep you alive because there is so many patients. And then I realized that this is arriving in Madrid, that in Spain, that the same thing is going to happen, and that the same thing is going to happen in the US, just maybe more slowly. So I starting to research the subject, and I get in touch with people I have known for decades who have been some of these experts that were working on airborne transmission, and they say, we believe that this virus is being transmitted this way, but they explain to me this historical bias that really the WHO and those types and CDC, they are dead set. They think this is so extremely unlikely, and which I was very perplexed, just like you were saying earlier that you were perplexed at my explanation. I was very perplexed at their explanation. Like, why? It doesn't make any sense. But we keep working on it, and as I said, we talked to them on April 3rd, and at the time we were already investigating the choir outbreak, and I talked to the choir directly. I was the person in our team who interfaced with the choir, and they really were extraordinarily helpful. And it was immediately obvious once they gave us the information about what they were doing, that the only explanation for that case in which one person infected 52 was transmission through the air, because they knew that the virus was in Seattle. This was, 50 miles outside of Seattle. And they knew that the virus was in Seattle, but there were no cases in their community. But they were already being very careful about the surfaces because there was so much emphasis. And once they told us what they did, it was impossible they got infected through the surfaces. And they didn't take much time. They only talked to each other for about 10 minutes. And during that time, each person would talk to 2 or 3 people. And the person, the index case, the person that later is known to be infected, didn't talk to anybody because that person wasn't feeling very well. So it's impossible that this would go through the droplets, even if there was another person that we don't know that was infected, that kind of thing. So it was obvious that it was airborne transmission, and we explained it in great detail. We have published a scientific article about it. But this gets denied. Then there's that report in July, as I was saying, from WHO, where they allude to the acquired case, but they say, oh, this doesn't prove anything, and they clearly haven't paid attention. And I mean, they come from such a deep prejudice that to them this is just unthinkable. It must be some error that we have made.
So with so many people that are following suit with what you're doing, do you think that you're starting to get a little more traction, and that you might be able to push the CDC or the WHO a lot more, or maybe even in a year or two, if hopefully things slow down with COVID by then, and there's some reflection on what happened, that that there might be something done to dispel this dogmatism that you were discussing?
I hope it doesn't take a year, but I mean, scientifically, it's clear what's going on is what's called a paradigm shift. Just like when Galileo said and Copernicus, that the Earth goes around the sun and not the other way around, or when Einstein came up with relativity and they said it's not really Newton classical mechanics, but really the universe has this other physics. And each one of these paradigm shifts, when there is some very established way of seeing the world and science, and then there is something that's revolutionary and that's very different from what's accepted. None of these ideas were accepted the next day. Galileo was imprisoned, and Einstein was basically accused of being completely wrong. And there was this book of 100 physicists against Einstein, where they explain all the reasons why they think he's wrong. So I mean, we're in a situation like that, and there's a book by Thomas Kuhn called The Structure of Scientific Revolutions, where he explains kind of these dynamics, and it's basically like the stages of grief. And they say at some point, the people who are clinging to the failing theory start to come up with adaptations, so they can keep that theory going. So the way that has played out WHO and CDC is now these droplets that they believe do the infection, when they need to, they behave like aerosols, but only when they need to, So for the choir and whatever, or for there were some. They are the droplets. They are the droplets that they think, but somehow they were behaving like aerosols. Like there was this high-level scientist in Australia, which is in the main panel that advises the government, and they had a case in which basically a security guard who was in the corridor of a quarantine hotel got infected because the air that was coming under the door had the virus from in a room where someone was infected, and then also maybe when the door was open. But that person never had any surface contact or any direct face-to-face contact with infected people. And he was saying, well, these are the droplets that are there in the room, and then when the door is open, they all come out. And it's like he's describing a behavior. The droplets they talk about fall to the ground. They don't stay floating in the air. If they stay floating on the air, those are aerosols. So I call them the magical droplets. They're extending the droplets into magical droplets that don't follow the laws of physics, but they can keep their fantasy going. That this is how diseases are transmitted, right? So anyway, it's failing, and I think more and more people have been coming into our side. I mean, I think there was also a sociological issue in the sense that, as I said, there are not very many medical experts who were researching this or who were, open-minded. So then a lot of people that have been helping this year, like myself, I'm a kind of a chemist and engineer, and then they view us as outsiders that don't know, we don't know about health. We are not from the health professions, and why are we even talking about this? I mean, WHO said very much this, basically dismissed us the 239 scientists as basically we didn't have the right training to even talk about this. And there was one of the committee members of WHO said that we were all chemists, engineers, and owners of ventilation companies. I don't know where he got that from, but implying we had some economic interest or something, and that we basically were unqualified to talk about this. So there has been a lot of resistance because, the people in the health field, so the people they know and trust, who are the higher ups in the health institutions, saying that we are crazy, and then a bunch of outsiders who have a very different training saying, no, this is airborne. So this has slowed things down a lot. But I think it's changing, and I think more and more people in the health professions are seeing, are now on our side. But it's still going to take a little bit. Before we send that letter to WHO on July 6th, after we started investigating the choir case, I basically emailed every journalist I knew saying, this is airborne, and then we have this choir case that we're saying, and basically almost nobody even replied. And some people replied and said, this WHO says this is crazy, and they didn't, nobody would interview us, or it was very, very muted. Once that letter appeared and got a lot of coverage and stuff, for months I was doing 5 interviews a day, and always thinking, we're finally gonna convince them, and then I can relax. And it hasn't really. It's gone very slowly because it's really so entrenched. And I really can't predict what's going to happen. I do think in the U.S. We wrote a letter to the Biden administration a year ago with a number of top scientists, but they haven't even replied. And what we've heard informally is that they're completely focused on eliminating the disease with vaccines, and they're not going to reply to us. These are still people who don't believe that airborne transmission is important. They think maybe plays a minor component, even though it's the main way the virus is transmitted. And they realize that they can eliminate the disease through the vaccines, with this very aggressive program. So then they don't have to deal with it. In other countries, it's going to be more difficult because you have these more transmissible variants. And in Europe, for example, they don't have enough vaccines, and they may have to contend with another wave, and in other countries as well. So the issue is going to stay alive for a bit. But I do not expect that there will be, next week or next month, WHO is going to say, is going to accept the reality that this virus is mostly airborne. I think that's going to take years.
Have you seen anybody affiliated with whatever public health organization with any particular country, maybe somewhere in Europe or South America or somewhere that have started to entertain the notion that taking seriously airborne transmission is the route to go, unlike the U.S.?
The U.S. has they have like with this school opening, they have now some new rules on ventilation, and they have been talking about how you should wear 2 masks and all these things. So they've been saying, kind of like WHO, they've been telling you what you have to do. And the only reason those things would do anything is because of airborne transmission, but they don't say that why. They just say you need to wear 2 masks or you need to ventilate, but they don't say why. So they kind of have been acknowledging it. And many countries have been saying that. And WHO came up a couple of weeks ago with some revised ventilation guidelines that have been written by my colleagues of this group of people that wrote the letter and everything, and which are very good. But in terms of talking more openly, what's missing is explaining to people this analogy of the smoke. Because otherwise, people don't understand why are we wearing masks and do mask work and why ventilation and how and whatever. Everything is very confusing because it is not explained why things have to be done. Christian Drosten, who's a virologist and one of the top advisors of Angela Merkel in Germany, so he's been saying for a year, it's like we have to explain it to people. If we explain it to people, then people can understand why we're asking them to do this or to do that or to wear a mask. And when in doubt, they can think about what they are trying to do with that measure, and they can, they can adapt to their specific situation. But we have not been doing that. In terms of, I would say just yesterday, actually, Argentina it's been the country that I think has been the clearest. And they came out with a program in which they were acknowledging aerosol transmission as being important, and they were saying it more clearly. And I played at least a small role there because I gave a talk last year, and I think I talked to the scientists there, and I think this arrived at the right time. There were basically the doctors and the public health people that work for the government were already very suspicious because they had seen a number of outbreaks that really made them think this was airborne, but they were confused because WHO was saying, no, this is not airborne. And then when we explained to them, that this is this historical confusion, of course it's airborne, I think that has people at high levels of government have been able to change things. And it's not perfect, but I think it's of the countries I have seen that I'm aware of how explaining things is the one that's ahead.
Yeah. Has there been anybody, like maybe outside of public health organizations or like your circle of scientists and academics that have started to try to persuade people or get the message out of COVID being airborne, like any sort of other like notable public figure that has gone on board? Because sometimes that's a good way for some message to get traction, is you just get somebody prolific to start pushing that message out. Has anything like that occurred?
Like some Hollywood celebrity or Bill Gates or something like that.
Yeah, like maybe not like a celebrity, but yeah, maybe somebody like Bill Gates would be a better example. Like not necessarily some actor or something.
Not that I can think of. I mean, I think we've gotten a lot of support, certainly from a lot of scientists and from a lot of healthcare workers. I mean, as I was saying, there is this kind of resistance, but it's in a very narrow segment of the health professions. It's in public health and infectious disease control, and even there we've made a lot of inroads. But then the regular doctors that don't work in these fields of disease transmission and who are exposed to the virus in hospitals, many of them have been really supportive. And there's this particular doctor in Canada, Lisa Yanatona, and she posted a message in Twitter, and she said, really listen to me. We should listen to these aerosol scientists because the number of hours that we study aerosols in medical school is 0. And we just really don't know. And these people are trying to help. So there's been many healthcare workers like that we've been working with. But in terms of someone with the prominence of Bill Gates or someone like that, I don't think we have managed to convince a person like that. I don't know any such people, and it's not always very easy to reach them.
Yeah, you mentioned Lisa Yanatone. Yeah, she's been great. You mentioned the smoke factor and people not really having too much of an understanding as to what's going on, and that ties in with all the confusion and everything. What would you say to just the average person who still thinks that, like, let's say like those plexiglass barriers or something like that, or like face shields? I'm trying to think of some other things that these are having some sort of big impact, and if you have this physical barrier, well, part of the way, because like whenever there's a plexiglass thing, it's usually actually relatively quite small in comparison with the rest of the area in which they're in. Like what would you say to somebody to try, to sort of put into perspective like how little importance that these things might have?
I mean, these are good examples of wasted effort. In some cases of what we call theater, pandemic theater, of making it look, doing things that are visible, like disinfecting surfaces or putting plexiglass barriers, but that they don't do anything, and they give you a false sense of security. So I mean, what I would say is that you have to think, and this is why I believe the analogy of the smoke is so important. Like, if you're in a room and someone lights a cigarette and there is plexiglass barriers around the table, something like that, that's not going to do anything. I mean, it may do something for a couple of minutes, but the smoke is going to get around. So the plexiglass barriers don't do anything except like when in a cashier situation of the supermarket, if you have two people that are talking face to face and you put a plexiglass barrier in the middle, that's useful because you break basically, and if you think the garlic smell, the invisible smoke that's leaving one person is going to be hit the plexiglass barrier and it's going to make it more difficult that the other person inhales it immediately, right? But when you see these lateral barriers in offices or things like that, this is useless. And in fact, it's worse than useless because it makes ventilation more difficult. It creates dead zones. So it can let the virus accumulate and then it doesn't go outside with ventilation so easily. The same with face shields. I mean, if you imagine you put a face shield but you don't wear a mask, and then someone starts smoking in the room you're in, you think you're not going to breathe in that smoke? It's absurd. It's going to go around your face shield, right? I mean, a face shield is useful if you're in a hospital and someone coughs on your face, and then it breaks those. In those cases, you do have those big droplets. It's the only situation where they matter. And then, this spit is stopped by the face shield. So they have their function. But you still see many countries that's all they wear. They're wearing this because they still believe in this dogma of the droplets.
Where is that exactly? Where they face shields are that primary?
Well, you see, I've been following in Twitter. So there's still, for example, in the Netherlands, and in some places in Sweden, there is some. It's interesting. I'm from Southern Europe, from Spain, so we always look up at Northern Europe at countries as if they were more advanced. But in this case, I mean, Sweden and the Netherlands in particular have been at the forefront of denying science and really doing everything wrong with respect to airborne transmission. And I don't know exactly. I mean, I think it's that their public health people and maybe their governments are especially strong deniers of the science and especially strongly bound to this dogma of the droplets. But that hasn't been good.
Yeah, no, I did a whole episode just on the Netherlands and then another whole episode just on Sweden, and it's not good. That's for sure. Okay. That's for sure. And one thing you said, I didn't know at all. Like I know generally how limited like plexiglass barriers and how you described it is how I've been describing it personally in my personal life to people I'm interacting with for quite some time, is that it's theater and it's all presentation and that's about it. But you mentioned like in an office space, it making it worse. Can you elaborate on that more?
Yeah, because basically if you have, at the end, if you have a virus that comes out of people like smoke, what you want to do, the best thing is to do it outdoors because outdoors is going to rise. There is much more movement of air and it's going to go away and there's less chances than the people you're with will breathe it in. Why we see that transmission is much, much more likely indoors. There are numbers people say 20 times or 100 times more likely is because indoors we're in a box and that box traps the air and then it makes that the air that someone exhales will have many more chances of inhaling it again, right? So that's, and then when you think about what ventilation is and why, we all recommend ventilation is that means that the air that's trapped indoors goes outside and clean air comes from outdoors that doesn't have the virus. Now, if you create barriers, you create pockets of air where the air is not effectively channeled away. So the air this bubble stay in between these tall barriers. And then that virus that if you didn't have the barriers may go outside, may be trapped. And then you have more chances of breathing it in, So really they can even make things worse. And we've been advocating for businesses and schools to remove them. I mean, if they have wasted all this money, they should remove them. In our university, the University of Colorado, so Professor Shelley Miller and myself started advising them about some of these control measures, and they had already bought a lot of plexiglass. because they thought it was useful. And we told them, no, you shouldn't install it except in this cashier situation. So then they install it in those places, but then they had this mountain of plexiglass that they didn't know what to do with. So I told my wife that works in the art department, and then they have donated a bunch of plexiglass and they are doing art with it. And that's a much better use of
it. Interesting. Yeah, I'd never really thought about that before. But yeah, say you have an office space or a room or whatever. That's at least kind of ventilation's okay. Yeah, if you have all these barriers set up, it's going to disrupt the flow of air.
Exactly. Yeah.
Yeah. So, I guess on that note, what should be some new things being brought into buildings as far as uh, air ventilation is concerned and air filtration? What kind of changes should be made? I guess particularly in schools, because that's been quite a hot topic for a while. Is a lot of places have had schools shut down for a year, and there's a lot of effects from having the schools closed so long that are really, really bad, and it needs to be addressed. So like primarily in schools, because there's still a lot of office spaces where people are working from home still, and it's less than favorable in certain situations, but it's manageable. But with schools, it's extremely different. Like what kind of ventilation and filtration should be brought in, as well as apparently completely doing away with these plexiglass shields and putting them in the recycling bin?
Well, so the most important thing that needs to be done is to admit that the schools are not inherently safe. I mean, there has been disinformation that has been put forward by some scientists and governments, just saying, schools are inherently safe. Children don't transmit and schools are safe. That's false. There's just plenty of studies that show that there is a lot of outbreaks in schools. Young kids may transmit less, but they spend a lot of hours sharing the air, and it's hard to have them wear masks. So there is transmission in the schools, and we have to accept that it's a place that is not inherently safe, but it can be made a lot safer. Now the decision of, I agree with what you said. It's very important for kids for schools to be open, and it's important for society so the parents can work and all these reasons. So that the end is a societal decision of weighing the risks and the benefits, But I believe if we're going to open the schools when there is still a lot of cases, then we have to do everything we can to minimize transmission. And then we have to take, all these measures. And the most important one, is ventilation, right? So ventilation has been historically poor, and in a lot of buildings, in the school buildings, and a lot of buildings in general, is poor. Why is ventilation poor? Because these schools have been built in a century in which it was believed that it was impossible to get infected through the air. So ventilation was not important, right? In 1944, William Wells, who was the person who was trying to demonstrate that tuberculosis was transmitted through the air, and he eventually was successful after his death in 1960, and it finally got accepted that tuberculosis was transmitted through the air, and that was the first disease that was accepted. So William Wells in 1944, where he was working towards this, he wrote an article in Science, and then he said, as a society, we have put a huge amount of effort and resources in making sure we don't get infected through the water that we drink, and we have all these plants and all these disinfection procedures and all these pipes and all these things that we do that do cost a lot of resources, but we have done it, and we have been immensely successful in preventing infection through the water. And we've done the same through food. We have made sure that the food we eat doesn't have pathogens, and when a pathogen is detected, we have a recall, and we have all these inspections and stuff, and we have been very successful. But for the air, it's not that hard. All we need to do is ventilation and some other things, but we have just not done it at all because it was believed that diseases just don't go through the air, so this wasn't worth the effort, even though the effort is not larger than, let's say, providing drinking water that doesn't have pathogens, right? So the problem is that we start in a bad situation. Many schools, especially the older ones, don't have good ventilation, and the kids in the school are breathing each other's air too much, and the teachers and everything. right? And then they can bring the virus home to their parents, So the first thing that we've been advocating for is for measuring carbon dioxide. So we humans exhale carbon dioxide, the food that we eat, we basically, our metabolism burns it to carbon dioxide, and then we exhale it. So if you are outdoors, you have about 400 parts per million of carbon dioxide, and that is what increases slowly, a few parts per million per year, and that causes climate change. But from the point of view of the pandemic, is changing very slowly, right? So you have about 400, and if you have an indoor space where nobody's there, it will have also 400. But now, if people go in, because our exhaled breath has about 40,000 parts per million of carbon dioxide, this carbon dioxide is going to accumulate, And for example, if you have 4,000 parts per million in a space, that means 10% of the air that you're breathing, someone else has already breathed it. It has already been inside someone else's lungs. And that's the risky situation. If you're breathing in a lot of the exhaled breath from others, you may inhale the virus someone infected has exhaled, right? So then measuring carbon dioxide is very useful, and it's the only thing we can do. It's the only thing that's feasible, that's available, that's low cost, to try to protect ourselves from the presence of the virus in indoor spaces. And you can get these CO2 meters there's different kinds, and the only one that works is the ones that use infrared technology. It's called NDIR, and they cost between $100 and $200, something like that. And with these, you can really protect yourself much better and identify the spaces that really are in need of ventilation, and how much do you need to open the windows. And what our colleagues find is that you don't need to open the windows completely. You can open maybe 3 windows 7 inches in a classroom, and that's enough. And even though the day is very cold, you can have enough ventilation and still be in the classroom and be safe. So we've been advocating that this should be done massively. In fact, by law, this was already a law before the pandemic in both Taiwan and South Korea, 2 countries that have done better, just for reasons of disease transmission, but also indoor air quality, and because we're smarter at lower CO2. When CO2 gets very high, gets to 1,000, 2,000 parts per million, we make decisions work, and the students make exams, make more mistakes and all that. So you can think, if we use ventilated our schools and our companies and everything, we would be smarter as a country. But we have known this for 2 decades and basically done next to nothing. While these other countries, like I was mentioning, like Taiwan, have moved more aggressively. But now in the pandemic, we should really measure CO2 everywhere and display it publicly. What we are like it's in Taiwan, we advocate that there should be anywhere where we share the air, whether it be a school, a shop, an office, there should be a display of the CO2 level. And if it gets too high, then we know we have to get out of there, or the business or the school knows that they have to do something. They have to open the windows more, or things like that. So anyway, ventilation is really important, and is generally the cheapest way to do it. But there are places, because maybe it's a basement, or some other, or there is just the windows are too small, or you cannot open the windows because it's too noisy or too smoky outside or whatever.
Or so too cold.
Or too cold, or too, well, it depends. You can still, as I said, if it's too cold or too warm, you can still open the windows a little bit and it's often enough. But let's say you can't, for whatever combination of reasons, right? So then what you need to do is to filter the air. What's a filter? Well, it's the same as a mask. A mask is a filter that we wear, and there is these pumps that are our lungs and our diaphragm that moves the air through the mask, and that's what makes the air go through the mask. So, but you can have also like a box that you plug into the wall, and there is a filter, which is just like a large mask, and then there is a fan, and the fan takes air from the room and passes it through the filter. And if there is virus in the room, it will stay in the filter, and then you don't breathe it in, right? And I have a colleague in Spain they've been putting these filters in the school, and then they analyze the filters, and they find that when there was some infected people in the classroom, they find the virus in the filter, meaning the filter is working, And you have you can do this with a fan, just with a box fan and a filter like the ones we put on furnaces, and this will cost $50. And again, it's crazy that this hasn't been done in every classroom, that we don't have one of these in every classroom, because $50 per classroom is something we can afford, Or you can buy these commercial HEPA filters, they're called, and they are more expensive, but they also tend to work well, although there is a lot of, there's a lot of variety. So filtration works very well if you cannot ventilate enough. Or if you have, just like if you have a forced air system in your house or in a business, all of those systems have a filter to protect the equipment and to remove some of the dust from the air. And normally that filter can be upgraded. What you find is that almost everywhere people use the cheapest filter you can get, which is what's called the grade 7, MERV 7. And most systems can tolerate grade 13, which is a much, much better filter, but it's still not so thick that the fan on your house can still push the air through that filter. And that really helps a lot in removing the viruses from the air. So that should also be done, and it doesn't have much cost. I mean, we're talking, so in my house, a filter costs $20 for the cheap one and $30 for the expensive one. So it's not really that much of a difference. Now, if filtration is not practical for whatever reason, like sometimes in a prison or in let's say in the emergency room waiting area, things like that, you can also use what's called ultraviolet disinfection. So there is these lamps that produce ultraviolet light, and we know they kill pathogens. That's how we finally demonstrated. It was finally demonstrated that tuberculosis goes through the air is using these UV lights, and we know they work against this virus. But it's something that's more expensive and more complex, and it has to really be installed and designed by professionals and maintained. So I'd say that's not for everybody, but that's useful. And then the problem is that with the pandemic, there's all kinds of people selling all kinds of things that are useless or dangerous, but they say that they clean the air. I mean, there's a lot of snake oil salesmen.
Oh yeah.
That are selling things that and lots of school districts that are buying this, wasting money on things that are endangering their students. So they say systems that clean the air, that supposedly clean the air with ions and plasmas, photocatalysis and hydroxyls and hydrogen peroxide. I'm a chemist, and I can tell you that the last thing you want to do is to try to kill the virus with chemistry, because the same chemical reactions that can hurt the virus can hurt you, and
right.
can produce toxins out of the compounds that are present in indoor air. So it's the last thing you want to do. But these things are being sold like hotcakes. And then there is also things like spraying disinfectants into the air, like either ozone or hypochlorous acid, which is like a type of bleach, or chlorine dioxide, different disinfectants that are being put into the air. And this is extremely dangerous and should be forbidden, in my opinion, but again, it's being sold like hotcakes. Like I know in many dental clinics, they basically spray bleach into the air in between clients, which is absurd because
bleach?
Basically hypochlorous acid, which is, bleach is sodium hypochlorite. So when it evaporates, it's hypochlorous acid. So they're spraying bleach into the air and used to disinfect the room. But this is absurd, because when you need the disinfection is when the person is there, not in between the patients. And you could instead have a HEPA filter right there, or this is basically they are like a vacuum cleaner next to the mouth of the person you're working on, and that's so much better. And it doesn't have any of these effects. But I mean, it's all kind of because people don't really know what they're fighting against. CDC doesn't really tell us what we're trying to fight against, and these dangerous air cleaners are not regulated. But it's just an explosion of this kind of thing. So you have to be careful, because you may spend a lot of money thinking that you're protecting yourself, and in fact you're making things worse.
So with these people that are selling these garbage products, are these just a bunch of charlatans who see an opportunity to make a quick buck off of people who are trying really hard on the fly to come up with something and are in some sort of state of desperation?
I mean, many of these air cleaners have been available for decades. And the problem is that it's kind of like the supplements industry, that is, these supplements that you will take and whatever. And there was this doctor I read that she was telling the story that she gets all these cancer patients that come to her clinic, and they have all these liver issues and whatever. And then she realizes that they're taking 1 million supplements. And then she tells them, no, you have to stop all the supplements immediately. And then the patients are shocked, because they think all the supplements are natural, and they couldn't think that But yet there is the supplements industry that managed to keep itself unregulated. So I would compare it with this situation. It's like there has not been a regulation. So a lot of these products, I mean, some of them we have evidence that are harmful. Others we just don't have evidence that are harmful, but we don't have evidence that they are not, because nobody is forcing them to do the studies. The studies can be done, but these people are just based on marketing, and they are just very dismissive of us, the scientists, who are telling them, you really need to study the food you're making byproducts, and they're trying to sell as much as they can during the pandemic. I mean, there is more serious actors who are trying to help, I think, and some of them are starting to do tests and things like that. And there are people that are more on the charlatan end of things.
Oh, okay, I see. But back to the ultraviolet light system and the filter and the filters. I guess one thing right away a lot of people would think when they hear that the ultraviolet light system to kill the pathogens that would pop into their head would be, well, is this harmful to me? And then with the filters, these filter systems, are they all pretty much good to go, or is there any sort of trials that need to be done, or does is just the science and theory behind all of it just solid enough that you can just implement them now and it's good to go?
So first, in the filters, I mean, there is the technique works and shouldn't have any bad effects, right? Because it's just literally a piece of material that will trap the virus, and then the virus is going to lose infectivity there, and then that works. Now, like anything, you can take any good idea and do it poorly. And for example, there is a colleague, Marwa Satari, who's an independent professional, and he's a member of the ASHRAE board, the American Society of Heating, Refrigeration, and Air Conditioning Engineers. And she's been doing a table or a graph illustrating all the different commercial HEPA filters. And you see there is a huge variation. There is in terms of the price to performance ratio and how noisy they are. And you can spend less money for a superior product, or you're going to spend more money for a worse product that on top of it is very noisy. And I mean, recently, just last week, Dr. Fauci, he said that he had bought for himself a HEPA filter and he was endorsing this. But then she put it in this graph, and it's basically Fauci had bought about the worst and most expensive and worst performing filter anyone could find,
Oh dear.
And this is, so this is a problem. And, so we were saying, it would be useful if medical professionals and engineers work together, because there is a lot of variety. And again, the government could come in and put some standards and say, your filter needs to meet the standards, and that would be really helpful. But right now, again, is the Wild West. I can make a box in my office and sell it and say this is a filter, and as long as people are willing to buy it, there is no regulation.
Okay, and then on the
ultraviolet. You were asking the ultraviolet light. Yeah. So the way the ultraviolet light is the traditional one. So this is not the same ultraviolet that in a tanning salon. It's actually it's a harder kind of ultraviolet that would be very damaging if it was on your skin. It's at 254 nanometers. Well, there's a wavelength, and that will be hurtful. But the way it's applied is normally one or two ways. Either you put it in the ceiling, but it has a cover, so basically it irradiates the air around the ceiling, but it doesn't irradiate people. Or you can put it in the ducts, in the air conditioning ducts, and as the air is going through the ducts, it's exposed to this UV light. The first system is better and works better. You just put it in the ceiling, and then you cover it so that the light doesn't impact people directly. So this works very well. I mean, we're studying how much chemistry it leads to. It is a little bit, but we don't think it's too bad for the particular system. But again, it has to be designed properly. If you design or you install it improperly, and then you allow this UV light to shine onto people, that's very dangerous. This light can burn your skin and your eyes, and so you have to, that's again what I said, you don't want to do that everywhere. That's not to have it in every house, that's to have it in places where you can have it installed professionally. There is a new type of systems that instead of 254 nanometers, they use light, a different type of UV light with 222 nanometers with these light emitting diodes. And the advantage of that light is that it cannot penetrate your skin. So it can only penetrate a few microns, which those cells are dead on your skin anyway or in your eyes. So basically, the advantage is they can probably be shown directly on people. And then those would be very efficient in terms of disinfecting the air because they can be everywhere, basically. You can go into an airport or a shop and they can be disinfecting the air. And if you exhale some virus, very quickly all the air in the room may be disinfected in this way. But it has a couple of problems. I think that's maybe could be the start of the next pandemic, but they are not really available. They're very expensive. And still I guess people are not totally convinced about the safety issues, and they just were not quite ready for massive deployment during the pandemic. But it's something that's promising, looking towards the future.
Oh, okay. Yeah, it's something that you could implement down the road, preparing for something to come. Because we're still fumbling around with masks and simple filters, much less these devices. So it seems like a stretch to really push hard for now. I want to shift to outdoor transmission because, and alluding to some of the things we said earlier, like some people are, it's just how much bad information has gone out, and contradicting information and just mass confusion. So you'll have people indoors that think that wearing any mask is fine and it doesn't fit very well, and that the plexiglass barrier at the cashier is doing something, but yet they're really adamant about wearing a mask outside when they're walking in the park, even if there's nobody really around. So what do you have to say about outdoor transmission and what we know that's going on there?
Well, so we know that there is much less transmission outdoors than indoors, but there is transmission and there is a bunch of cases, and they're all basically the same thing as far as I know, which is people talking closely. You're talking to someone close, and especially if you're not wearing a mask. And you can imagine, again, you understand it very well with the smoke analogy. If you're talking to a smoker outdoors, but you are 2 feet from that smoker, that you may end up breathing a lot of that smoke. So that's the situation in which people get infected. But once you are outdoors with distance and with a mask, then it's almost impossible to get infected if you're wearing a good mask. So it will be very safe. And we've been saying one of the things that should be done everywhere is every activity that can be done outdoors, be it school or a work meeting or meeting with your family or whatever, should be done outdoors. Now, outdoors means outdoors. This has been understood in some places during the winter as you could, as long as you were on the sidewalk, you could build this completely closed tent or igloo or something, and then that was outdoors. And that is even worse than indoors because many of those were because it's cold in New York or whatever, or here in Boulder, and they were very poorly ventilated, much worse than the restaurant that they were, the indoors of the restaurant they were belonging to. So I think those are kind of virus incubators.
Oh, those. Yeah, I don't think there's any around where I am up here in Western Canada. But yeah, those pods or whatever that they would have outside at a restaurant. Yeah, those look ridiculous.
Yeah. But that has been very widespread, and again, it's because it hasn't been explained. It's like there was just this. There are all these statements from the public health agencies that outdoors is safer. So then people run with that. Outdoors is safer. So then, as long as you're in the sidewalk, even though you are in a pod where all the air is trapped, because you are outdoors, that must be safer. And that's just absurd. But anyway, so then outdoors, so I was saying, you are walking with someone or something, you are close to someone, even if you try to keep some distance, I would still wear a mask. Now, if you're in the middle of a field or you're in the middle of a park and there is nobody around, really you don't need a mask. I would say, they are, the chances that the virus is going to come from they're infinitesimal. So I would say, I mean, sometimes like when I go walking around town, most of the time we are not near anybody, but then, now and then there is a runner, there is someone that crosses by. So I still wear like some kind of mask just because it makes me feel calmer or whatever. But and also kind of to set an example, I guess but I don't think it's so important. I mean, the problem that I mean, when we talk to people in public health who are kind of advising some government something, they really ask us to not say that masks are not needed outdoors and not say that too loud, because basically what they find is that people get very confused. It's very, and if the message gets out, or if the government says that outdoors you don't need a mask, then people interpret any situation outdoors, and then they step out the door and they remove the mask, no matter how many people are, no matter whether they can keep the density, the distance, or whatever. So then kind of what they've been saying, some governments were reaching out to us, is like just say you need a mask outdoors. And what that government was doing is like, we already told the police that if there is someone without a mask and they're away from other people, or they're in a park, or they're not going to say anything to those people. They already know. But then the fact that you have a simple rule that you always have to wear a mask in public makes it much easier for people to understand and to enforce. And they do have a point. However, I also noticed that this creates a lot of resistance, because then there's a lot of people who think, well, rightly, that this requirement to wear a mask when you are in the middle of a field or a park, there's nobody around, is absurd, And then they start, well, if they don't trust that thing that's being asked for them from public health, then they start not to trust anything, And again, since it's not being explained clearly why we need to do all these things, and one of them is absurd, then you start to suspect maybe all of them are absurd, and that diminishes the compliance with these public health rules.
Yeah, gotcha. So it'd be, walking through a park, probably don't need a mask, but yeah, if you're walking down a busy street in Manhattan, it's probably not a bad idea.
Yeah. I mean, that's what I would say. I mean, it's it also depends. If you're in a windy day, that the exhalation from people are being dispersed very quickly, then it's very safe. If you're outdoors, but you are in a very narrow alley in Manhattan where there is very little circulation of air and there is a lot of people, that's kind of a semi-indoor situation. It's like something intermediate between indoor and outdoor. So you kind of have to, and again, it's something like everything I'm telling you, once you think about the smoke, it's clear. You just imagine that whatever situation you're doing, people are exhaling smoke. Is that a dangerous situation for inhaling smoke or not? Right? And then everything I'm telling you, you can learn yourself.
Right. So if there was effort applied to get that bit of messaging out, the concept of smoke, and then just some elaboration, people can then circumstantially discriminate from what situation they're in to another, what they should be doing, and they can make their own decisions accordingly. Like, well, I'm in this busy corridor, it's technically outside, but maybe a mask is wise, or I'm just going through a walk through this field or this park, don't really need a mask. They could just do that instead of just having these rigid laws and that don't necessarily make sense.
Yeah, and another situation where this plays a role is, for example, a common situation is someone is inside the driver is inside a taxi or an Uber and they are not wearing their mask, or some person is inside the shop and there is nobody else than the person who works there, so then they are not wearing their mask, and then someone comes in and they into the taxi or the shop and then they put the mask on.
Right.
And they are making a huge error, because they should wear the mask at all times, because if they're infected, they're putting a lot of virus in the air. And then now the customer comes in and is breathing air that has a lot of virus. And if they had been wearing a mask the whole time, there would be much less virus in the air. But because the emphasis has been on these droplets that basically they come out of you, and then the moment you put the mask, they stop coming out and you're safe. There is this cacophony, in which, again, we're wearing masks all the time, but transmission doesn't go down so well, and it's because we're doing things poorly.
Yeah. So, like, and as masking right now is still, it needs tons of improvement. Would you recommend that people, like, for the present, start doing their shopping at a grocery store or whatever, as soon as possible, then like right as soon as it opens, before people have gone in there and are able to you know, uh, fill the volume of the air in the building with virus.
It's a good idea. I mean, I think there is a better idea, which is if there is places that offer online shopping. I mean, this is what we've been doing the whole pandemic. Is we just shop in supermarkets and we order online, and then we call when we arrive, and they bring it outside, and then we take it into the car, and that's how we shop. You don't always get the best pear or the best lettuce, but we take
right.
We take that as a small
It's a small
penalty
loss.
for being
Yeah.
safer. Yeah.
Yeah.
So but if that's not offered where you are, then I would definitely go first thing in the morning. I mean, it's worse, So it is if you have some very large supermarket that has a very high volume of air and not a lot of people and has good ventilation, that's one thing. But if you go into a small shop that maybe doesn't have a lot of ventilation, that's a different thing. So there's also the relative risk of different venues.
Got it. And then on the smoke part, so let's say you're like just trying to conjure up that imagery, then it'd probably be good to tell somebody if they're like biking outside or jogging, like if you have somebody else jogging a ways ahead of you or something, like try to not be so consistent in following them, and keep quite a considerable amount of distance there to not get in their path.
Yeah, that's a good idea. Yeah. Because when you are jogging or you're doing heavy exercise, you are exhaling a lot more of these aerosols. It's just the heavy breathing leads to more aerosolization of your respiratory fluid, right? So you can imagine that someone who's running is not just smoking a cigarette, it's smoking a cigar. It's making more smoke. So the last thing you want to do, and that smoke, it will be staying behind them. So you don't want to be following very closely, whether in a bike or or running or something, so that you have a high chance of inhaling the air that they are exhaling, especially if either or both of you are not wearing masks. You wanna keep more of a distance. Yes. And again, I mean, I guess it will also depend. Again, if it's a very windy day, it probably doesn't matter. But if it's a more quiet day, that the air is more quiet, and you can see sometimes their exhalation, kind of the condensation on their breath, and that's staying behind them, and you're running into that very quickly, I would keep more of a distance.
Okay, yeah, that makes sense. I think it's probably a good time that we should wrap this up. Before we call it a day, do you have anything else that you'd like to say to the audience? What somebody in the public might need to know to look after themselves? What is there anything else that somebody might need to do in their personal life to try to mitigate risk in accordance with airborne transmission that they should keep in mind?
I mean, I think we've covered it pretty thoroughly, but just to repeat, is the idea that people exhale an invisible smoke and you don't want to breathe it. And you think about that in every situation, and that will give you the clue about what you have to do. So wearing a well-fit mask of good quality in all the situations when you share the air. And also in a place like if you are going to have guests, you should start wearing the mask an hour before the guests show up, not put it in when the people show up, right? And all these ideas about the ventilation and measuring CO2 and the filters, like all of those things work very well, and they are not that expensive. And also like doing things outdoors, it's like it's the most frustrating thing is like to realize that these measures work very well. And in the places where people do ventilate, they do not have outbreaks, yet that they are not being done, or not being done in the scale that they should. So I would say just think from that angle, and there is a lot of information we have. For example, these frequently asked questions on the internet that we put together that among 12 scientists, and we basically explain all these things I've been saying, and you can find links and things like that. But Yeah, that people should protect themselves, of course, and then people should get the vaccine as soon as they can. And hopefully, we can all be
Definitely.
leave COVID behind as a nightmare period in our lives.
Yeah, that's also a very important message. Get vaccinated, people, as soon as you can. Oh well, you mentioned those FAQs. Where can somebody hunt that down?
So it's just a hopefully easy to remember address. So it's tinyurl.com/FAQs dash aerosol. So again, tinyurl.com/FAQs.aerosol. And if you go there, it will take you to this document.
Okay, cool. And is there anything in particular that you'd like to say for people to keep track of you? Is Twitter your main outlet?
Yeah, I mean, I have to say, I'm of a generation that I really wasn't into social media before the pandemic, but that's something else that and especially when the journalists were not listening to us and we were trying to reach out to people and warn people about airborne transmission, I started using Twitter, and I found it actually very effective. So I would say, and I use it to talk to other scientists, and it's very useful to people in my field or people in different fields, as well as to try to communicate to the public. And some of my Twitter address is my initials, which are JLJ, and then Colorado, the state. So just JLJ Colorado, and there I am.
Yeah, keep track of them. You've got a lot of great stuff going out on Twitter and in both languages.
Mm-hmm.
Awesome. Well, thank you so much.
Okay. Well, thank you very much for your time.
Thanks for listening to this episode. The music you hear on this show is from the Jeff Lapp Trio out of Montreal. Find them at jefflapp.com. Shout out to Tara for doing the graphics for COVID On Air. A huge thanks to my editor Jeff at Bean Co. Studios in Regina, Saskatchewan. Please visit endcoronavirus.org for more information on ECV. Click on Join Us. Through that, you can volunteer with ECV, and you can subscribe to our newsletter, which is full of great information shot straight to your inbox from our delightful newsletter editor, Tracy. Also, please check out the blog at ECV, and hats off to Scott, our impeccable blog editor. You can find ECV on Facebook and Instagram and on Twitter at nCovid19. You can find me on Twitter at Mr. Farden. It's at MrFarden. Till next time.